So again, I'm a solo practitioner. I've always been, don't really work a lot with a lot of the pharmaceutical companies. So I kind of consider myself a MacGyver of aesthetic dermatology, and you'll see why. For those of you who are under 35, MacGyver was a very popular TV show in the mid-1980s. He was a spy who could basically break up any kind of device using duct tape and a little bit of wire. And I kind of think of myself the same way. I'm always trying to invent new ways to do things with the old product that I have, with the old uses that I have. Again, since I have a small staff and it's just me seeing patients, I like to use the things I have as much as possible instead of buying new things constantly every year. So I had a sort of a revelation after I got a radiofrequency machine this year that early hand aging can be related a little bit to a loss of volume, but I think more importantly, it's really a loosening of the skin, which in young women starts around the knuckles and then sort of proceeds to the dorsal wrist and then goes on to the dorsal hand. And it's funny because a lot of this revelation came to me when my friends started posting their engagement ring photographs on Facebook, and I'm like, man, I didn't think her hand looked like that. And a lot of the women are like, this is how women are. And they're like, oh, that's a nice picture of a ring, but her hand doesn't look that good. If you guys were to guess how old do you think this person is whose this Facebook post is?
Her hand looks like she's 45.
Yeah, right?
40.
32.
Damn.
So that's what I'm saying. We don't realize a lot of times that people are aging their hands. And we talk about this pigmentation and everything, but this sort of early skin laxity thing, specifically around the knuckles, really ages their hands. So I've been doing a lot of radiofrequency for early hand aging before they need filler, before they need their veins treated or whatever. And they're getting very good results that last a long time. This is a patient I did 2 radiofrequency sessions on. I have an old lizards of Iora, and basically focused on her knuckles in the area, sort of on the dorsal hand, and she was very happy with this. She's in her 40s, and that's all she really needed. If you think about your hands, I've had veins in my hands since I was a kid. That's not really what's aging me. I've had thin hands since I was a kid. So volume loss isn't what's aging me. I noticed that the skin around my knuckles is starting to get loose, and so that's what I'm doing now, and I'm getting very good results, and people are loving my hand rejuvenation packages. I also then will combine it with dyspigmentation treatment with India or cryotherapy. This, I know all of us probably know about the R20 method, multiple pass tattoo removal, and whether or not you use perfluorodecolon between passes or not. There's a new perfluorodecolon patch. I don't know, have any of you guys used it yet? Anybody in the audience? It came out this year. It's kind of expensive, so I haven't really used it. I use a little bit of the spray fluid that's made by some of the companies. I haven't found that it really makes that much difference in terms of the timing, because in between passes I can go see another patient and come back, and it's really not an issue. But what I have found lately is with my multiple pass technique, each time I do a pass, I really vary every parameter of the laser. And I have an old key-switch NDI laser. You can do this with your fancy Pico-Shore or whatever you have, where with each pass you vary the spot size. In that way, you will get the tattoo pigment at every possible level of the dermis and even beyond possibly that the tattoo artist put. I always tell the patients, we don't have charts from the tattoo artists. We don't know whether they put your pigmentation. They're sort of going blind, so it's good to get multiple spot sizes, and then that way we can get the pigment and ink at several different levels. And then obviously changing the wavelength pads and changing the energy levels, and we also discussed the PFD. I love the PFD this time last year. This year, I didn't use it as much. Okay, so this is a video. When I do Fraxel for under-eye circles, I really hate under-eye circles. That's like the bane of my existence cosmetically. I think, especially in people of Middle Eastern, Indian subcontinent, this kind of practice is a real problem. The issue is it hemosiderin? Is it just a sort of a loosening of the eyelid? So what I figure out is when I do my low-dose Fraxel, I actually will try several different mini passes at very, very low energy. So looking at 15, between really 5 and 15 joules and very low densities. And you should be able to see an immediate lightening. Sorry, the video won't loop, I know, right? You guys can't loop it again. But you see an immediate lightening of the skin immediately after you do it. And that's when you know you're in the right place for this person. So you'll actually see the result right away. And that's when you know that you're in the right place where the brown pigmentation is gone.
What do you use in terms of the energy levels, Jules?
Like I said, the joules are between 5 and 15, very low. And what I'll do is I'll start them at like 15 or 15, depends if it's you or me, I would start at maybe 10. And then I do like a tiny, like a 2 millimeter pass, and I see right then whether it's lightened or not. And if it's not, then I'll go a little higher, try that.
10 and 6 or something like that?
10 and 6, 10 and 5. So I don't care about the density that much. Like the density is somewhere between 5 and 8, but I care about the joules because I think the joules is exactly, you want to be exactly the level where that hemicidal is, and you don't know where it is until you've actually done it. So I'll start at 10, like I said, do a little 2 millimeter pass. If it's not gone, I'll go to 12, maybe I'll try 14. It takes a few seconds. And that's been the way that I find that in one treatment session, I can get rid of under eye circles due to this reason in under skin patients. And it's been very effective.
In one session?
In one session, yeah. And you know, they have to come back. They need maintenance probably once or twice a year, depending how bad their circus are. And that's it. I told you I'm always the one who finishes up.
Thank you.
You're welcome.
The Viora is what kind of device?
It's a radio frequency. It's a low. It's one of the first ones on the market. It's an Israeli one. We don't sell it a lot here. And it has no consumables, and so I don't charge a lot for it. And people seem to really like it.
So maybe like Pelave?
It's probably like Pelave. I didn't own a Pelave either. It's not as painful as Pelave. And so I charge a low price, and the patients get about 20 to 30% improvement in skin tightening per session.
Which Fraxel was that you used?
I used to Solta or Big Fraxel. I tried CFT for a while, and I felt like for the downtime, my clients were into the downtime for the results. And that depends on the practice. You know, if you have a more surgically oriented practice, they're more interested.
Which wavelength were you using? What's the wavelength?
1550. So I can't see who's speaking to me. What is it?
It's Randy Wall.
Oh, okay. Yeah, it's a 1550. Okay, good.
Well, thank you.